Welcome to Pulse Pressors, where critical care gets crystal clear. Midazolam is a short-acting benzodiazepine with rapid onset and predictable titratability, making it ideal for ICU sedation and procedural use. Its imidazole ring allows water solubility in acidic solutions, pH less than 5, but at physiologic pH, greater than 7, the ring opens and becomes lipophilic, explaining its rapid CNS penetration. This property, combined with high receptor affinity, underpins its popularity for induction, sedation, and seizure control. Midazolam's versatility lies in its multiple formulations. The oral tablets, though less common in ICU use, are still relevant for preoperative or anxiety management. Its aqueous solubility minimizes injection pain, but prolonged infusions can lead to accumulation of excipients, such as propylene glycol, potentially causing hyperosmolarity or lactic acidosis in renal dysfunction, an underappreciated but real ICU concern. Midazolam acts as a positive allosteric modulator at the GABA-A receptor, strengthening the inhibitory tone of the CNS. Unlike direct agonists, it relies on endogenous GABA, limiting maximal effect and enhancing safety margins. Clinically, this translates to anxiolysis, amnesia, and sedation, with rapid recovery when used appropriately. Midazolam's kinetic predictability is offset by context sensitivity. Infusions beyond 24 hours can extend emergence dramatically. Protein binding and redistribution into adipose tissue cause lingering sedation in critical illness, especially during ECMO or Impella support, where altered pharmacokinetics reduce clearance and increase volume of distribution. Metabolism occurs through CYP3A4 and CYP3A 5:1 hydroxymidazolam, which is equipotent and contributes to prolonged sedation when renal clearance falters. This effect is amplified in ECMO and renal replacement therapy, where metabolite removal is incomplete. Careful titration and daily sedation breaks mitigate accumulation. Midazolam has a relatively stable cardiovascular profile, but can cause hypotension if given rapidly or in volume-depleted states. Its respiratory depressant effect is dose-dependent and synergistic with opioids. For ventilated patients, it provides deep sedation, but must be paired with vigilant monitoring and capnography during procedures. Midazolam's flexibility allows use from preoperative anxiolysis to continuous ICU sedation. Geriatric and debilitated patients exhibit heightened sensitivity, often requiring only half the typical dose. Infusions above 0.1 milligrams per kilogram per hour are rarely necessary outside status epilepticus or alcohol withdrawal. In the operating room, midazolam complements anesthetic agents, providing amnesia without excessive hemodynamic compromise. In ECMO circuits, drug sequestration requires patience and careful titration. For cardiac support patients, Impella, LVAD, or low EF, incremental dosing minimizes afterload shifts and hypotension. Midazolam remains a cornerstone for procedural comfort and amnesia. Its synergy with other sedatives allows lower cumulative drug doses, while its anticonvulsant effect provides a dual advantage in neurologically unstable or ventilated patients. Prolonged midazolam infusions risk oversedation and delayed awakening, particularly in renal impairment due to metabolite buildup. Propylene glycol toxicity is a subtle but dangerous complication in high-dose or long-term infusions. Daily sedation interruption, renal monitoring, and use of non-benzodiazepine alternatives when feasible are evidence-based safeguards. Monitoring should focus on depth of sedation, airway patency, and hemodynamics. Reversal with Flumazenil must be applied judiciously, as its shorter duration can lead to resedation. In critically ill patients, the key is steady titration and early transition to lighter sedatives once stability allows. Advanced practice clinicians should recognize midazolam as both a powerful tool and a potential trap, unmatched for short procedures and crisis sedation, yet prone to metabolic accumulation in ICU scenarios. Its balanced pharmacokinetic profile, combined with a clear understanding of its pH behavior, excipient toxicity, and geriatric dosing principles, defines expert-level safe use. This is Pulse Pressors, reflecting on the marvels of the human body. Subscribe to stay sharp.